such as anatomy, physiology, biochemistry, pharmacology, who are still relevant even in the newer problem-based integrated curriculum. Not all clinicians, including myself, can teach basic medical sciences as well as the medical scientists. At the same time, with a comprehensive medical curriculum, especially in the later clinical years, there's a greater need for medical teachers and tutors. I can personally vouch for this, as I migrated from the UKM semi-integrated curriculum previously to the fully integrated problem-based curriculum at Monash in 2004. At the same time, medical teachers are repeatedly told that they should get a higher academic degree, i.e. a PhD or MD. You can see in front of you here people who have got either a fellowship in radio oncology or a PhD or PhD and further training overseas and so on. And they must at the same time get a certificate of medical education. That means they must be trained to be teachers to be able to teach you, as well as trained to be scientists to be able to do scientific research in this institution. Just being a consultant is not enough, nor having a PhD. One has to be trained to be a teacher too. But how many of our specialists, Raisa, will do a PhD after getting the specialist degree? Very few, only in universities. But how many universities actually do that? How many more will go on after their PhD and get training in medical education? Very few. So whilst we are lamenting the need for more full-time teachers in the medical schools, we should also realize that very few will want to spend their lifetime like me as academics. And fewer still will want to pursue higher academic degrees. With the newer medical schools being set up, Raisa, the same small cake of medical academics, like some of you here and me, are being cut up into smaller and smaller pieces, isn't it? We should demand higher and higher pay, man. There are only 3 medical schools in Malaysia with their own teaching hospitals, namely University Malaya, UKM, and USM. The idealists within us will say we should teach in specialized university teaching hospital. And I was one of those idealists back in 1995. And we fought to have this hospital. To us, having a university teaching hospital would enable us to practice the art of medicine at the highest level. And students, you all, will have exposure to the best practices of medicine. We would be able to control the types and numbers of patients that we see. And we would be able to set up highly specialized tertiary services combined with clinical research for the advancement of medical science in this hospital. At that time of our development, we wanted so much to have our own bone marrow transplantation unit, if some of you will remember. Our own cardiology, neurology, nephrology, neurosurgery, endocrinology, infertility units. We were not able to do that when we were in GHKL. But we were able to set up these units when HUKM was built. And I am a recipient of the successful implementation of that policy to set up the bone marrow and stem cell transplant department. Some of the departments in the teaching hospitals have become centers of excellence and referral centers. But how many of the clinical departments have actually become centers of excellence? Can the university's cardiology department compete with IGN, for example? This is not just for HUKM, but it's also for UKMMC and HUSM. Why has this not happened? This is not just because of lack of staff, or is it because lack of institutional support, or has the clinical burden exploded beyond control, and there are now too many patients who need not be managed in such hospitals like this, but are still hanging on to the doctors or hospitals' so-called reputation. They are seeing too many patients, and the visits between patients are 9 months apart, 6 months apart. You will never achieve the standard of care that you're supposed to give, and you're so overburdened you cannot do research. Now we see such teaching hospitals have become more of a burden rather than a proper referral hospital providing tertiary services. These hospitals, excuse me, these hospitals cannot control the demands of the population and have become no different from the Ministry of Health service hospitals that are provided by the government. The budget to run HUKM per year is greater than the budget of the states of Kedah and Perlis combined. Incredible. The burden of providing service has increased so much that teaching has at times been put as second task, not the first task of the lecturer. And our clinics have now become beasts of burden, with more and more patients to see and patients being reviewed at longer intervals. So the academics now have less time for research. There's no point for them to acquire PhDs and MDs if they have no time for research. Our idea was that patients with difficult problems should be referred for management at this hospital, and the simple ones should be seen by the family physicians at surrounding community clinics. This has worked very well for the Ministry of Health system. But we are seeing too many primary care patients coming to this place. Now I am back in the Ministry of Health hospital, and I find the teaching at Hospital Sultanah Aminah in Johor can be very effective and conducive. The Ministry of Health doctors are now more involved with teaching, Raizat. They are more involved with training, and they are ever willing to be involved even at the highest level. At the same time, we find that the specialists and consultants from the private hospitals and clinics who volunteered are even more committed to teaching than my predecessors in my previous life. Thus, medical education in Malaysia has a great future. We need to harness the enthusiasm of our colleagues in the Ministry of Health hospitals. We need to harness the enthusiasm of our colleagues in the private sector and bring them into our fold and not depend just totally on full-timers. We also need to change our attitude to medical education needs. It cannot be quantified. Rise up when you are the president of MMC, please remember. It cannot be quantified just by the patient-to-bed ratio. We need to assess the educational needs at each year of the curriculum and determine how this can be achieved. For example, the exposure to normal pregnancy need not be done at hospital clinics and the ONG wards only. In fact, it is best done at the community polyclinics, isn't it? Similarly, our partners from the private sector are equally good at bedside teaching. Some of them were experienced academics in their previous life. Must we have a fixed ratio of full-time to part-timers if the educational needs are met? Lastly, we need to be brave and start using our private clinics as a source for medical education. And this can be done and has been done in the private sector. After all, the Mayo Clinic, the Stanford Medical School, or the Johns Hopkins are all private teaching hospitals. If they can, Malaysia pun boleh. And HUKM pun mesti boleh. And change its direction to the altruism with which it was founded, and which I fought so hard for. To be the hospital where patients are referred for difficult management, where teaching is done at all levels, including the undergraduates, which would be their first priority, and to be the hospital where medical research can flourish. Why am I emphasizing on medical research? Why have I insisted that our academic staff get training in research and attain higher academic degrees or PhD and MD by research? What has it got to do with you, the young, enthusiastic medical students? Why do you want your teachers to have basis of medical research? Because only by being a research-based university can we be in the forefront of medical education and training. Only then can our medical graduates be at many levels higher standard than the so-called universities mushrooming all over the place in this country. You know, university this, university that, university technology, university infrastructure, lah, apalah. Yeah? Only then, if you are a research-based university, research-based faculty will be a much, much higher level. Only then can our graduates, you all, be recognized by other countries, which is being done so now for Singapore. But we want you to be recognized, your degrees to be recognized, not only in Singapore, but also Australia, United Kingdom, etc. And get further training and opportunities. Many of your friends, or many of your seniors in front of you now, had no problem getting recognized places for teaching in radiotherapy or PhD and so on, isn't it? But you should never let the standard go down. Medical knowledge has exploded in the last few decades with the advent of it has expanded in the last few decades with the advent of new technologies, such as the unraveling of the human genome, the development of recombinant technology, proteomics, and nanotechnology. We can now have designer drugs, i.e. drugs made and designed to fit into recently discovered proteins or genetic products or alteration of genes. These new technologies are no longer figments of imagination. We are already testing and we are already using the products of these technologies, such as the so-called magic bullets of specially designed monoclonal antibodies to kill or inhibit certain cells having specific protein markers on the surface. The drug rituximab or MabThera is designed to knock off CD20 lymphocytes specifically, and I am treated with this drug every 3 months to keep my disease at bay and keep me alive. Similarly, we have recombinant technologies designed for diagnosis of diseases. We can determine in embryos whether they have the thalassemia gene or whether they have the gene for muscular dystrophy or cystic fibrosis and so on at the embryo level, at the protoplast level. We can determine whether these genes are present from their parents before the embryos are implanted in the uterus of the mother and allowed to mature into full-grown fetuses. And this is available now in Malaysia and at my private hospital, Tropicana Medical Center. The list goes on and on. In fact, we can now use stem cells to regenerate tissues such as my bone marrow. How wonderful medical research is. It's kept some of us alive. In 1982, I adopted and was a strong proponent of the phrase in 1982, some of you may remember, I put it all over my doors, medical research, a matter of life and health. And Tan Sri Abu Bakar Sulaiman used to quote to the Ministry of Health people. Khalid is very funny. He has this slogan, medical research or a matter of life and health. This slogan was taken from the Medical Research Center, Prince Henry's Hospital at Monash University, where I was trained. I never knew then that I was going to benefit from that phrase and how true it could become in real life. Because it's only with medical research have I got life and health now. Your training as a future doctor is not to remember or to know about all these new technologies and therapeutic options or diagnostic methods. It will forever be evolving and expanding our field of options exponentially. Your task as a student and future doctor is to know how to assess this information when you are faced with clinical situations and determine whether there is evidence based on medical research to show how good a diagnostic method or technology is, or how effective a therapeutic option is, or whether you may do more harm than good by the therapeutic measures. These information are now easily available. They are easily available. How? They are at the tips of your fingers that tap the keyboards of your laptop, your PC, or your BlackBerry. Yeah? You don't need books anymore. I don't buy books anymore. The training you need is to critically appraise the information. I'm sure you got that from this scientific program that you have got. Is that right, Rojima? Then there is now no reason for you to rely on getting information or following information from your gurus, your mantan gurus, whatever, or from your lecturers based solely on their experience. Their experience may be relevant, or my experience may be relevant in the previous era. People like me have to also keep up with new information using the electronic media. What we want to impart in you is that medicine education is a lifelong procedure. Otherwise, we'll become fossilized like the old Tyrannosaurus Rex dinosaur. They used to call me TX, Tyrannosaurus Rex. You know what is Tyrannosaurus Rex? Yeah. That Thus, your medical education must contain the element of evidence-based medical practice and how to obtain information, critically appraise it, and put it into practice. But how can you do this if you do not know much about research methodology? If you do not know how to apply what type of statistical method of analysis, or understand what is meant by confidence interval, or numbers needed to treat, etc. Thus, research methodology must be taught in the undergraduate curriculum in order to enable our young doctors to practice evidence-based medicine. And I see you are now getting that in your curriculum. That element of your training will forever make you a good and effective and a safe doctor. This teaching can only be done at undergraduate level if your teachers are also research-based practitioners who are at the forefront of medical research. This is what distinguishes great medical schools like Cambridge and Yale and the Mayo, or even Singapore National University and Tokyo University. If you are a graduate of such schools of such high reputation, your degree will be welcome everywhere and anywhere. So how can we foster medical research at your level and harness the enthusiasm of such high flyers like most of you in UKM? One way is to have this training program that you have, and I salute the curriculum that incorporates research. Another way is to have the Bachelor of Medical Science Honours degree. Bachelor of Medical Science Honours degree, which involves 1 extra year in your medical training. It means you will graduate, it means you will, it means you will graduate later by 1 year, but it also gives you great training to have a critical mind and an analytical approach to medicine. You will have the opportunity to understand research methodology in greater depth and its limitations and so on. You may also then go on to do your PhD with greater ease. And you will turn out to be a better doctor. I believe so, as I was one of those fortunate ones who spent an extra year at Monash University doing my Bachelor of Medical Science Honours degree. Took 1 year off training to do my honours degree. My wife, however, does not think so, as I probably wasted 1 year of being able to earn a living by graduating later than her. And I have to live off my wife's earnings as a houseman while I was a final year medical student. For that, I'm ever grateful to her. And I will always love Norella Kong Chiu Tong for standing beside me throughout my training in medical research, my trials, my tribulations during my training, and my PhD degree, and also during my recent illness. Thank you for giving me the opportunity to speak to all of you. May Allah bless you with knowledge, bless you with humility, and give you gratitude. Salam to all. Thank you.
Majlis merakamkan jutaan terima kasih atas ucap pertama yang disampaikan sebentar tadi. Semoga pelajar-pelajar tahun akhir sekalian seia sekata, seiring dan sejalan menjadikan kata-kata dorongan yang disampaikan sebentar tadi sebagai kenyataan.
Bagi meneruskan majlis, dengan ini dipersilakan Saudara Muhammad Fadli bin Muhammad Fauzi bagi mengiringi yang berbahagia Profesor Dr. Rozimah Haji Idrus tampil ke atas pentas bagi menyempurnakan upacara penyampaian cenderamata kenang-kenangan daripada kami warga Pusat Perubatan UKM. Dipersilakan yang berbahagia Profesor Emeritus Datuk Dr. Khalid Abdul Kadir, Terima kasih Yang Berbahagia Prof. Seterusnya, dipersilakan Yang Berbahagia Dr. Rohaizat bin Yun. Terima kasih Yang Berbahagia Prof.
Majlis merakamkan ucapan terima kasih. Dengan berakhirnya upacara penyampaian cenderamata sebentar tadi, maka selesailah majlis perasmian persidangan saintifik tahunan penyelidikan mahasiswa perubatan kali kedua yang telah selamat disempurnakan oleh Yang Berbahagia Dr. Rohaizat bin Yun. Harapan besar kami adalah untuk melihat setiap pembentangan pada hari ini berjalan lancar. Selamat maju jaya buat semua pelajar yang bakal membentangkan hasil penyelidikan mereka sebentar lagi.
Kami mewakili pihak majlis menyusun 10 jari memohon kemaafan sekiranya terdapat sebarang kekurangan sepanjang berlangsungnya majlis perasmian ini. Dengan itu, majlis mempersilakan Saudara Muhammad Fadli bin Muhammad Fauzi dan Yang Berbahagia Profesor Dr. Zui Mahajir Idrus untuk mengiringi Yang Berbahagia Dr. Rohaizat bin Yun serta Div-Div Kehormat untuk melawat pameran poster di Galeri Kompleks Pendidikan Perubatan Chancellor Tuanku Jaafar. Dengan segala hormatnya, dipersilakan.
Hadirin mohon berdiri.